Good afternoon, good evening. It's a pleasure to be here with all of you today. I'd like to thank Anya and Ivona for the invitation to talk with you a little bit today about system variables and dissemination of autism intervention programs. I also would like to thank my colleagues who are noted on this slide, as well as everyone presenting today, as they are the directors of several programs that have participated in gathering much of the data I will share with you today. Okay, so let me start by basically reminding you of a basic tenet of our field, and that is the right to effective treatment. In 1968, Beowulf and Risley included that as one of the most important characteristics of applied behavior analysis, and it's absolutely true to this day. We have seen autism prevalence rates increasing over the years, and the autism community certainly has embraced this concept of right to effective treatment. So we've seen the devotion of resources to individuals with autism. We've seen growth in research on specific teaching procedures to help students acquire skills. We've seen professionals entering the field rapidly, and the beginning of and well established now certification programs for behavior analysts, as well as special education teachers, uh, kind of demonstrating an interest in autism intervention. And from all of this, we see the development of kind of standardized curriculums and, of course, programs for individuals with autism. But unfortunately, even though we've seen an increase in the number of programs or agencies who are serving people with autism, we don't necessarily see an equivalent increase in high quality, effective, and sustainable programs. And of course, that is a bit of a concern. So you have to ask the question of why does the quality not keep up? And probably one of the main reasons for that is the lack of a clearly defined system of how an agency should operate. It is important to define the variables that should affect your overall organization so you can have some consistency and success, and of course, accountability in any program when you're serving people with autism. Some of the issues that we face are with the increasing number of junior staff entering our field. We have a high training need. We need a lot of resources to bring people up to the level of skill they need to be effective. And unfortunately, there aren't that many senior people who have the skills to do this. So we start to see a lot of variability in clinical behavior and clinician behavior. And then I would also kind of highlight the point that even though many of us have received lots of training in how to interact with people with autism and how to use certain procedures, very few of us have had any education, mentorship, or training in how to actually operate a program for people with autism. So we have to look at systems, and what does a system offer? Well, basically systems are necessary to ensure quality. And that's because they allow you to organize your team and your agency, to specify practice guidelines for the agency, and ensure, of course, consistency in practice. The last thing that I want to note is accountability. When you have a system, you have rules about how things operate, you have methods of assessing, and all of that will allow you to be accountable to providing excellent services to the individuals with autism. So these are all important benefits of a system. Specifically, when you look at an autism agency, whether that's a school, a private school, or a public school, or even just a home program, you have to use a system to guide your practice. It's important to define specifically what the therapist or the teachers are supposed to do. And equally, how is it that the trainers, right, the people who are responsible for getting teachers to do their job, how do they educate, mentor, and support the staff? As you heard Dr. Krantz say in that video earlier today, a program is only as good as the teachers who deliver the services. It's very important. And of course, when you have rules and guidelines about how to interact and how to basically deliver intervention, you can go ahead and assess your progress towards the goals. And the data that you collect to assess how you're doing will ultimately serve as feedback back into the system to allow the system to change and evolve over time. If a system doesn't change and evolve, it's just going to stop and basically eventually go away. A system has to change as the science changes. And as you've already heard, there were none greater when it comes to developing systems. Doctors Lynn McClanahan and Patricia Krantz were absolutely pioneers in the field of autism intervention. And in 1993, they published the article on systems analysis and autism intervention program, which defined their expertly designed systems at PCDI. But not only did they run an excellent program and design systems, they provided mentorship in a way that nobody else has. All of the presenters here today in this symposium had the honor of working alongside Drs. McClanahan and Krantz and acquired skills so that we ourselves could go off and open programs that would be able to operate using the model that they, in fact, created, so that we too could provide excellence in autism intervention. And so you've heard about the Alliance for Scientific Autism Intervention a little bit earlier from Anya. And in fact, we are a number of programs now, and you can see starting as early as 1970, a number of programs who have come together to preserve and extend the model that Drs. Krantz and McClanahan have defined. We have several objectives. But most importantly, we want to disseminate excellence in autism intervention when it comes to system variables as well as specific teaching procedures. We want to mentor young professionals and agencies. And of course, conduct research, collect data, especially on how a system and how a model operates, and use that information to feed back in to advance the model. So let's talk about a few of the system variables or the program parameters that Drs. McClanahan and Krantz defined. Staff training is incredibly important. It's necessary that any agency serving people with autism has a method by which they will identify professional, clinical, and data analytic skills for the staff to acquire. Similarly, you have to ensure that there's a sufficient number of senior professionals to provide mentorship and teaching and training to your junior professionals. And not only do you have to have enough of them, the ratio of trainers to teachers has to be quite strong. This is not something many people talk about. You hear a lot of discussion about high staff to student ratios, right? Like where you will have a 1-to-1 ratio. But very rarely do you hear people talk about the importance of also having one trainer be responsible for a small number of teachers. By doing that, you're going to ensure that you have sufficient didactic and hands-on training opportunities. So let me show you what the ratios look like, or the number of staff that every trainer is responsible for looks like in our programs. First, before I explain this particular graph, I will be showing you a series of graphs throughout my presentation that will all look very similar. And what you're going to see is the dependent variable, of course, that I'm trying to present to you for each of the programs, which are each a different colored bar across a 4-year period, so that you can see the sum of the data of these sites that are all working together using the same model. Here, you're looking at the number of staff that any one particular trainer is responsible for. And what you can see is we're pretty consistent in supporting staff in a very strong way. Each trainer is responsible for at most 6 individual teachers. So that's important because that ensures that our senior staff are providing sufficient training opportunities, mentorship, support to the teachers who are delivering the services. This is a graph of the didactic staff training that each of the programs has done over that 4-year period as well. You'll see a little bit more variability in these data, but consistency pretty much within a program in terms of the number of hours that we provide annually of kind of classroom workshop-based training, which is important in terms of giving the teachers and the staff members a vocabulary and some general information about behavior analysis. Of course, it is not sufficient. Hands-on training is really the most important training. So once you know what staff should be doing, you need to make sure you have a method by which you're going to assess the achievement of their goals and their responsibilities. All of our programs use the same tool for training purposes and assessment purposes. And this, again, is one of those variables that's critically important. So basically, yes, we do teach to the test. We let staff know exactly what is expected of them. We provide training throughout the year using that protocol and giving them feedback in terms of how they're performing relative to the goals that have been set. And then we use that same tool to assess their behavior. This results in positive evaluation experiences because there's far many more rewards delivered because you've helped people acquire the skills and then assess the acquisition of those. Our training and evaluation protocol will assess three kind of global areas, if you will. While we're conducting an evaluation, we will look at client performance specifically to see how the students are behaving and learning during that teacher's evaluation. We will also assess the professional and clinical performance of our staff. And then last, we'll look at the skills that a teacher has in actively programming for a student in terms of goal selection, and then of course collecting, analyzing data, and using those data to make changes over time. In the end, all of this evaluation will result in feedback to the teachers, to the trainers, to the administration. And it all interconnects, if you will, such that the contingencies are yoked, meaning if a student performs well, then the teacher receives rewards, and therefore so does the trainer, who is the person responsible for having the teacher acquire those skills. So if you have well-defined training efforts and skillful people delivering, you should have good evaluation outcomes. So let's take a look at how our programs have performed in terms of the number of staff who pass their evaluation each year. You can see that red line across the graph is what we consider to be criterion performance. We want at least 80% of our staff to pass their evaluation. But what you can also see is that very consistently, in fact, all years except for one program, 100% of the staff who were evaluated passed their evaluation. When you are teaching students, right, so you can say, well, staff have passed their evaluation, we've assessed their skills, they're great. You really still have to ask the question of, does that in fact mean that students are acquiring skills? So we have to look at the behavior of the students themselves. What we know is that if you have consistency in training and evaluation, you will in fact have positive behavior change in clients. So it's very important to establish some method of and regular ongoing method of assessing client progress. It's important to not just look at whether or not students are making progress once a year, but on a regular basis to ensure that progress is being made and is being made in the most efficient manner possible. We do that in all of our programs at the individual student level, of course, but we also do that annually where we look at how the whole program, in fact, is doing relative to producing change in our students. One measure that we use to take a look at how students are performing is a broad, but I would say very telling measure, and that's engagement. What we do is about every month, one of the senior staff members will walk through the program and do what we call a sweep to look at each of the students who he or she comes across and make a determination about whether or not that student is on task, engaging in appropriate learning activities, appropriately manipulating materials. This is kind of a really interesting measure that if you think about it, it's an unannounced visit into the classrooms. There's no time really to prepare for it. This is really an observation where you're going into the classrooms and saying, are the students engaged? Because if you're not engaged, you can't be learning. And this is what we find when we look across the programs for, again, that same time period. You will see that the criterion, again, level of on-task data we would expect would be about 80%. The percentage of intervals that are scored on task, in fact, is well above 80% for all of the programs for every year. So this quick sweep of engagement in the students reveals that, in fact, the teachers who have been trained are ensuring that the students are engaged on task. But of course, again, that's not sufficient to know whether or not they're making progress towards their goals. So we need to also look at that. What we have in each of our programs are what we call individualized programs. So every agency has a data notebook for a student that basically has a program that defines what response is being taught, how it's measured, and what is the specific teaching procedure being used. We are going to look to ensure that those components are all present, as well as the fact that there should be behavior change for any individualized program in place. And then we will ask the question of whether or not that programming is appropriate. When we do this again at the individual level, we're looking at any one particular student, but we also do this to look at how the entire program is performing in this area of making sure clients are meeting their goals by inviting an external evaluator into our program annually to sample the data notebooks for our students. So let me share some data with you about that. We can see here that that first set of responses I talked about, the percentage of programs where we see the program has been sufficiently documented, or what we call individualized, meaning contains a response definition, measurement procedure, and teaching procedure. Again, far above criterion for all of the programs every year. So we know they're well documented, but are they producing change? And here again, you can see the percentage of programs producing desired behavior change for all of our agencies is well above criterion every year, demonstrating in essence that, in fact, we are producing change. And then one more measures, are these programs appropriate? So the external evaluator has used his or her judgment, research in the field of behavior analysis, his or her clinical history and skills, as well as ethics, to determine whether or not they're appropriate. And again, what you see here are for all of the agencies across the years, well above criterion percentage of programs being scored as appropriate. So now we know that staff are trained well. That's one of our variables, right? We've made sure that we're evaluating staff. That's another important variable. We've looked at progress for our students. So now we turn to consumer satisfaction. Just because students are making progress doesn't mean, in fact, that the consumer is satisfied, right? When you want to determine whether or not you're making a change in a socially valid manner, it's important to turn to your consumers, who are our parents, staff, and board members, at least. You would define your own consumers. And what we want to know is, are they satisfied with the services that are being provided? And if they are, then of course this supports that the outcomes we're producing are meaningful. And again, they will provide very valuable and important feedback to the overall model and system so that we can make required changes as we move forward. Annually, each of our programs will conduct an assessment of consumer satisfaction where we survey these consumer groups, asking about critical areas or issues related to them as a consumer. And each of them will score their satisfaction level on a scale of 1 to 7 in terms of whether they are completely dissatisfied at a 1 or completely satisfied at a 7. And then, of course, we summarize those data and review written feedback that they provide to us to look for any kind of trends and any kind of valuable information about things that we might want to do differently in the future. So let me share with you quickly some data from two groups. This first you'll see 4 graphs. These are the data that were collected from the parents, and these are their scores of satisfaction. So again, you can see 1 to 7, 7 being what we, the highest level. 6 is a criterion level score, which means the consumer was satisfied. And we can see here across the areas of familiarity, and staff competence, effective intervention, and communication, that the parents have consistently scored these areas as satisfied. So again, now we are saying, okay, our parent consumer group is pleased with the outcomes that have been produced in these areas. Let's take a look at our staff. So we will conduct an assessment annually as well of our staff members, because they are important consumers as well. And we've asked them here about staff training, career development, evaluation services, and of course, program responsiveness. And again, what you see are very consistent scores at or above criterion on all of these measures as well, across all of the agencies. So again, we're getting some feedback that the consumers are satisfied with what we're doing. So I will kind of conclude with the statement that systems absolutely will allow you to effectively disseminate any knowledge, any information, or any model that you've already begun to work within. But in order to do that, you're going to have to define the critical variables. You're going to have to develop that model, maintain it over time, and then ultimately systematically transfer it to other individuals. By doing this and collecting data throughout that process, some of which I shared with you today, you will ensure the fidelity of the implementation of that model. And if you're able to bring that model across different programs, you're going to interact with different program ecologies and cultures. And if you're able to sustain the model, you have more evidence for the value of the model. So, in my final statement, I will say to you, absolutely excellence is achievable. And that's a good thing, because Doctors McClanahan and Krantz settle for nothing less than excellence. They diligently define the system variables that pave the way for all of us presenting today to open and operate programs using the model that they define so well. Our data, some of which I shared with you today, demonstrate the successful dissemination of the systems and the model, and the fact that we are able to get similar outcomes across a wide variety of measures. This is fantastic news because it means we'll continue to work together towards ensuring a bright future for individuals with autism by continuing to preserve and implement this model, but of course advance it as our science continues to develop. Thank you for your attention.